Okay, I've talked a lot about myself, so I'm going to try not to. And I know PHUTI doesn't like it when I cry. So then if I talk about myself, I cry. So maybe not this time. When this honor was bestowed on me, my first reaction was embarrassment. There are so many people that deserve this more than me. And I've spoken enough about myself. But then I thought about courage. Courage is the strength to make good choices despite fear or obstacles. And I realized that we need to celebrate courage and that courage gives hope. So I want to tell you some of the people in my life that is so full of courage. They actually brought infernos of courage to my life. A few years ago, I was just diagnosed with epilepsy. I got 10 textbooks on epilepsy and read them all. And I'm still dancing around the diagnosis. When this mum sits with me, my son is not okay. He's not listening. He looks me in the eye and later tells me I've said nothing. He's anxious, he fights with me. Something clicks in my head. This is epilepsy. This is not ADHD. It's not behavioral problems, but I'm very unsure. It's a child. I refer him for an EEG and a child neurologist. Easy to do the EEG quickly. It does show epilepsy, but the waiting list for a child neurologist for an appointment, 6 months away. Reluctantly, I agreed to treat him. And now he's one of my stars. He's doing exceptionally well in school. He is better behaved than most children I know of his age. And he's a star. I sit in my office and an old friend walks in, colleague. Her anxiety has been uncontrollable. She has numerous previous diagnoses. And again, something clicks in my head. This is not a mood disorder. This is not anxiety. We have trouble stabilizing her. And once the family is following her for miles and kilometers down the highway where she drives without being in touch with reality, she now is fully controlled and has her own business and is doing very well and drives normally. A few years later, a young woman walks into my office, telling me of her substance abuse, anxiety. She tells me about a story, stopping on a highway, and the walk gets bigger and change shape. Why is the theme of highways there with epilepsy? The Pretoria-Joburg highway has a spot where the guardrail and the oncoming traffic just flickers at the right amount of time. And most of my patients get a seizure when they drive that route. This lady starts a mess. She works on her other issues, and her baby is coming soon. That's quite nice. Epilepsy fully controlled. I love people with addiction. People with addiction is my people. I'm just going to tell you another story of them. Everyone else has written of these people. If your child starts acting unusual, out of character, you have to go and look. The patients that I see with addiction and epilepsy is staggering. Either the epilepsy was there first, or injuries and drug abuse caused the epilepsy. The young lady with the methylphenidate Ritalin addiction walks in, and her story doesn't make sense. This is a puzzle piece that I have to put together. And then it comes. She had a sports injury that actually caused a fracture of her skull. And it looked very mild and wasn't picked up, but it caused epilepsy. So this top academic student, I'm talking about Golden Pede, first 100 at university, had to use Ritalin to help her with her concentration, because that academic that came so easily for her wasn't able to be there anymore. Treating her epilepsy, she's really doing well. But she had a huge impact on her life. The degree, where she was almost finished, to complete it, took 3 more years. But her life is going well, and it's unfolding with kindness. Reaching your full potential is a privilege. So few people manage it normally, and so few of my patients with epilepsy can reach their full potential. And a lot of this is due to misinformation and the management of people around us. This is so clearly seen in a person with a university lecture who's the boss of the feels that she has to move to the student accommodation on campus when she asks for reasonable accommodation, just like she might stay home 2 days a week because transport is not. So just move on to the campus. That will fix your epilepsy. Then there's the patient, business professional, top of her work, wholeheartedly giving anything, but then had a car accident. And the company just refused basic accommodations, and she loses her job. The professional, these are not addicts, just by the way. The refused patient who tells his professional board and then have to fight 7 years to get back his registration and reputation. I have to mention here, it's not the medical council, it's not the HPCSA. They have been professionally helpful to my patients in supporting. This was another professional board. The patient had missed school because of the illness and then can't find a job because he doesn't have matric. And his ability becomes a huge obstacle in his life. However, the biggest spark, the bushfire, full of courage, is the patient with epilepsy and psychogenic non-epileptic seizures. You guys don't know what psychogenic non-epileptic seizures are, that is seizures without the electricity. People can't manage it, they can't control it. It is like epilepsy, just much more difficult to treat. The mum had to repeatedly explain to doctors what the illness means. Medical professionals tells her daughter it's pretending and they waste her time, she can stop the symptoms. But this is not a decision, it's a neurological disease like any others. The times they have to live through well-meaning strangers, commenting on the care of their daughter. The times doctors put her on dangerous medication, when they quickly look up the medication name on the internet, Googled an international name, test her blood for medication, which is done negative because she's not on that, and then they tell them, you're not helping yourself, you're not giving the patient the medication. The amount of times her patient's parents had to take off work. Their courage will cover the world in sparks. Their courage is the sun. I'd like to finish with my patient, the first one I told you about. The world threw out such a blessing. The new parent in his life, his dad, also has epilepsy and understands it. Hope is always present in our life. But in people with epilepsy, psychogenic non-epileptic seizures, and other neurological diseases, the sparks unite and makes flames to show the way. Well done to those that fell and got up to go again. Those people judged and those people feeling hopeless and exhausted. Come sit at the fire. Your courage gives me hope. Enrich my minute, my hour, and fills my life with kindness.